The number one question I get when people want to retire by far is not about their investments, it's not about their Social Security, it's how do I pay for healthcare? Today, I'm going to walk you through how we help people answer that question, and the answer is a lot better than most people expect. So here's what happens. You've been working 25, 30, 35 years, you've had healthcare, the premium comes out of your paycheck automatically every month. You don't have to think about it, but you're still a few years away from 65 to take Medicare. So what do? So this is the moment where people panic or they make a really expensive mistake because there's a lot of choices. There's COBRA, there's ACA, private insurance, HSAs. They all have different limits, different rules, and so what is a person to do? So let me tell you what I see happens all the time. Somebody retires at 62 and they just want to go on COBRA. It's the health insurance that they've always had. It's familiar, it feels safe, but what was $200 or $300 or $400 a month is now $1,800 a month. We've had clients that have even paid $2,400 a month, and it only lasts 18 months. So you're not only paying top dollar for insurance, but you have something that expires. And the whole time you could have qualified for something that costs less, dramatically less. So let's talk about the part that most people don't know and honestly surprises a lot of people. Your ACA marketplace subsidies are based on your income, not your assets, not your net worth, but your income. So let's think about it. You've been earning $150,000, $250,000, $500,000 a year, but now in retirement, your income is what you pull from your accounts. And if we're thoughtful about where we pull the money and when we pull the money, your taxable income can be dramatically different. And that matters because the difference between qualifying for an ACA subsidy and not qualifying can be the difference between $1,800 a month premium and a $300 a month premium. We've literally had clients whose monthly premium was $0 for the exact same coverage. And I want to be really clear about something, and this is important. This is not gaming the system. This is not hiding income. This is about being strategic about when and where we take income, how we take it out of your non-qualified accounts, when we do IRA to Roth conversions. This is about not overpaying for something that you don't need to overpay for. This is just math. Most people have never had anybody run the math for them and show them how the math works. So you might be asking yourself, if this is such a big deal, why hasn't my CPA or my financial advisor brought this up? And the answer is most CPAs are focused on what happened last year and just getting your return done. The value is in the proactive planning. Proactive planning does not happen in April. It happens before the end of the year. Most financial advisors focus on managing money, which is important. But if they haven't gone over your healthcare options in the future and how you need to structure your money now, that's a gap, and that's an expensive gap. So at Middlebrook Wealth, what we do is make sure your CPA, your attorney, and your financial plan are coordinated. That is the role of the financial quarterback. And for the healthcare piece, that's where the money is. So let me paint a picture of what this looks like when it's done well. So you're 60 years old, planning to retire at 62. You've saved a bunch of money in your IRA. You have a little bit of money in a brokerage account. Maybe you've been putting away a few dollars in an HSA for the last couple years. Right now, you're making $300,000. But in retirement, you only need $120,000. Where that $120,000 comes from is important. The answer to that can change your healthcare costs by tens of thousands of dollars a year. So here's how we think about it. We look at the big picture. We look at all the accounts that you have. What is in each account and the tax implication from pulling from those accounts. Then we think about your personal financial goals and how much income that you need to achieve those goals. And then we compare that to the income levels for the ACA subsidies. Third, we coordinate with your CPA, because what you do in October, November, and December, that is what matters, not what you do in April. And fourth, we look at your HSA, because if you've been funding it for a few years, you could be sitting on a pile of money. This money comes out tax-free, and this is exactly what this money is designed for. We're built for the person that has done the hard work of saving, the person that's built up a few $1,000,000 and doesn't want to spend the first year of their retirement becoming a health insurance expert. We coordinate with your CPA, your health insurance agent, your attorney. We do the math, and then we present the solution that's best to you. That's who we're built for, and that's what we do. We'll look at your situation and give you honest feedback. And if we can, we'll go over next steps. If we can't, we're not gonna waste your time. You've done the hard work for decades. Don't let one decision unravel a bunch of your hard work. Come have a conversation with us. If you wanna find out how much you could potentially save on healthcare and retirement, click the link below. We'll go over your situation, pull up the numbers, and give you a straight answer.